Those looking to get their COVID-19 vaccine at a local hospital clinic may be out of luck for the time being. State health officials say they are diverting their supply to mass vaccine sites and other community clinics.
But not if lawmakers can help it. Western Mass News reporter Audrey Russo is live for us in Springfield with more. Audrey.
State Senator Eric Lesser says so far the legislature has been reluctant to second guess the state public health department's vaccine rollout plan. But he says this new move is concerning and he feels more action is needed.
Why on earth would you stop sending vaccines to the people that know how to administer them the best, which is our hospitals? Look, Massachusetts has the best hospitals in the entire world.
Governor Charlie Baker this week raising concerns about the state's allotment of COVID-19 vaccine supply from the federal government, basically unchanged from week to week, only 100,000 doses.
When are we going to see the big move on federal distribution? Because we're now to the point where we really do have more capacity than we have supply.
Making a move on this, the state's goal is now to divert vaccines away from hospitals and to community clinics and mass vaccine sites like the Eastfield Mall. State Senator Eric Lesser says he's not satisfied with that plan.
I went to the Eastfield Mall site, and I can tell you it leaves a lot to be desired. I don't think it's fair that our residents in Springfield and in Western Mass are sent to an abandoned Macy's.
Western Mass News reached out to local hospitals. Bay State and Mercy Medical Centers are hopeful they will be able to fulfill appointments that have already been made for the next 2 weeks. But Bay State's website is no longer booking future appointments at their vaccine clinics. And those using Cooley Dickinson's patient portal are receiving emails saying they can no longer make new vaccine appointments. But those with existing appointments are still scheduled. Lesser criticized the state's rollout process as a whole.
They're constantly changing the rules. Everybody is holding their breath at every press conference and pronouncement about what's going to change today. What new criteria, what new change is going to make it even harder for people to get a vaccine.
He says legislative action is not off the table.
I do think the legislature will have to get and will become much more involved, including potentially looking at some of the underlying statutes here to force a better process.
And we reached out to 3 of the local hospitals for further comment. All declined our request. Live in Springfield, Audrey Russo for Western Mass News.